is all about making life easy for our people.
but in service of the vision uh, uh, shared by millions across the continent as and far beyond its shores. A vision of African connected, empowered, and dignified by its own people, wherever they may be. So, what is ADC? ADC is actually a group of African professionals that had a like mind to come and create an impact to improve the lives of their loved ones back in the continent. For years, Africa has been facing this long-standing brain drain. A lot of technological inventions in the Western world today are actually developed by Africans. So the mission of ADC is to reconnect these human resources that are bound, that actually originated from Africa back home. So we've created a digital marketplace where they can now connect to their home country. Mind you, this is not just a Nigerian project. It is an African project. In fact, as a matter of fact, the board secretary of this African Diaspora Corporation is from Liberia. So this is meant for the entire Africans because for centuries we have had this massive brain drain and we want to revert that. And the only way we can do that is to use the 21st century technology and create a marketplace or a platform, or if you want to call it a digital mall, where Africans can easily and seamlessly access opportunities in their country. And what we have done is to create this platform, and this platform will grow with a lot of initiatives. We are starting with housing as well as healthcare. Now, let me talk about the impact of healthcare here. We know that today we are facing a great challenge in terms of the expanding world economic or global economic crisis. And we know that the number one metrics to judge the efficiency of healthcare delivery system in any country is access to healthcare. And access to healthcare is determined by funding. And in this global economic crisis, then we ask ourselves, we need to start to figure out alternative ways to fund healthcare. And that is why one of the initiatives that the African Diaspora Corporation is about to launch is what we call diaspora insurance. Now, people in diaspora can actually help improve the overall healthcare in this system. One of the challenges most of us in diaspora get is when we send money, either the money is not used to buy the medicine or go see a doctor because the person needs to buy food. And the other thing is that because of lack of funds, a lot of times when somebody is sick, he stays home and doesn't go to a doctor. And when he doesn't go to a doctor, the disease gets worse. And when the disease gets worse, it costs more. And when he finally goes to a doctor, the doctor doesn't do anything because he knows he or she doesn't have money to pay. So what we are trying to do now is that those diasporans in Africa across the continent, instead of giving money to their loved ones, they give them an insurance card. They go to the registered, trusted, licensed insurance that publish on our platform and buy a policy for their loved ones. And then in that case, they don't have to worry about those emergency calls about how they're going to take care of their families. So we have a lot of other initiatives like education, skill acquisitions, transportations, etc. that is coming on. So overall, what we are trying to do is find ways to improve the quality of life of our loved ones and families back home. And creating a seamless way to reconnect with them is the best way in this 21st century. They don't need to be here, say in Nigeria or in Ghana, to be able to do that. They can be anywhere in the Western world, and they'll be able to assist and improve the economic condition back home. At this point, I'm going to yield perhaps maybe to our director of strategy, maybe say a few words, and some of the other rest of my board members. They can share their knowledge back home, just like few of us in this organization is trying to do, to share our knowledge that we've gotten from the Western world. Because today, products and minerals are gotten from the Africa and sent to the Western world, and those minerals are used to produce something and brought back to us. And guess what? The people that actually does that often are Africans. If you travel to America, there is at least, I don't have a specific figure, but you probably get at least 10% chance when you go to a hospital, you're going to be seen by an African. But before you're done, you're going to be seen by African nurse, African doctors. So we're trying to see how we can make them get involved and engage. And the only way we can make it is make it easy for them to access what they can participate in. And that's why what we created is like a mall. Just like you remember a mall, when you go into a mall, you shop what you want to shop for. We are not selling anything other than we created that digital mall. And that's the objective of what we are doing. So this diaspora hub you're going to hear is actually a mall by itself to make it easy for them. And at this point, I'm going to call to Dr. Eje, maybe say a few words to just in addition to what I've mentioned. Yeah. We want to leverage on the 21st century technology to reconnect families, to let those in diaspora have access to opportunities. Because in this day of an age, everybody has a mobile phone. These things can be accessed through your mobile phone. And once you make it so easy for them to access it, they'll be able to know it exists. Prior to this, you have to go Google it, look for it on a website. But now, it is simply like going into a mall. You go into a mall, there are different stores. Again, like I said, we are not the owner of the stores. We are just the owner of the mall. The digital marketplace is just to give a platform, because when you go into the mall, you don't ask who is the owner of the mall. You ask who is the owner of the store, and you deal with the owner of the store. Like Mr. Soprano is here. If you go to their business, you through the app, you communicate with them, and then you transact and buy properties. And that is what we're doing. We're just making it easy and accessible for diasporans, because this is the age we are, the age of technology. I can bet every of us here has a cell phone. So when you make it so easily accessible, then you improve the number of engagements. And that is why we say we want to reverse the brain drain to brain gain, so that many diasporans can now access the information and thereby increase the number of engagement. And having said that, unless there's any more,
will serve that purpose of basically connecting diasporans who wish to come back home to do some kind of investments or some kind of participation in any kind of activity. So we became very thoughtful in what we did and created this wonderful hub called Diaspora Hub, which is going to serve as a one-stop shop for any diasporan who is interested in reconnecting with activities back home to actually go through that. Our organization also stands for that. That's what ADC stands for. My board chair has talked about the health insurance, which is a key signature activity that we're engaging on now. Now, to explain a little bit further on that, so everybody will know what we did. Basically, we looked at insurance platforms and insurance offerings of different groups, different insurance companies here at home, all over the continent. We dissected them, those of us in the medical industry. We walked through them, tried to make these offers, insurance offers, look close to what we have overseas. And if we can get our fellow diasporans to look at this insurance and believe that this is something that's worth offering for their family members, right? And they can invest in these plans to cover their family members at home. That's in a nutshell what we did. The biggest problem, the biggest impact of what we're doing is that we're going to help to expand access to healthcare, even to folks in the rural communities. Because the biggest determinant of health outcomes is access to healthcare. So if you don't have access to healthcare, then everything goes down. But if you can improve this access to healthcare, then you've practically enriched a whole community. And the only way, one way to do this is by creating these insurance programs, health insurance programs. And that's exactly what we just did here. I will leave the rest of other.
In Nigeria, we have 7% of healthcare insurance, and that's quite poor. And statistics show that we have over 20 million Nigerians in diaspora. I'm not specific because I'm the country director in Nigeria, so I'm specific about Nigerians in diaspora at the moment. This is African Diaspora Corporation. It's a continental project. But being the country director in Nigeria, I'm emphasizing to Nigerians in the diaspora, it is time to come together and improve our healthcare back home through the support to your families and loved ones. We're simply providing a platform to provide this help to your. Diasporans has been helping their families and loved ones back home, but it's time to bridge the gap on the healthcare. Hence, we want to encourage diasporans. It is time to come together. Go to the diaspora hub and support your families and loved ones. We are here to support the government to improve the healthcare in Nigeria. I think at this point, I will yield to our consultant to speak to
ADC in this effort, as we will be able to give people in the diaspora opportunities to find not only good healthcare, but also a home for themselves or their loved ones at some point in the future. There are two things I needed to point out before I yield, and that is, first, the diaspora, the African diaspora, is a sleeping giant. We, or ADC, will do its part in trying to wake it up and steer it into action. But it's not enough. A lot has to be done. Political leaders have to listen, create the conditions for the diaspora to be able to invest back home. But this is the part that ADC will do, and I am sure it will do it well. So this sleeping giant must be awakened. And the way to do that, and that's my second comment, the way to do that is not necessarily only from the Nigerian side. You, gentlemen, who live and work abroad, have to spread the message in the diaspora over there, through their local organizations, through their committees, communities, and so on and so forth. They need to know that this opportunity now exists for them to look after their loved ones back home, and also possibly, as I said earlier, build a bridge back home to their native country. Whether that is Nigeria or Liberia or Kenya, it makes no difference. So I am here to support your efforts, and through the company I represent as well, we are there to make every effort to help and to assist. I congratulate you and thank you very much for your
aspirants to come home and assist in the development of their countries. And this is one of the burning reasons why we came together and established ADC, to respond to that government clearing call to come and tap into available resources here in Nigeria and in the rest of African continent that will assist improve the life of our fellow Africans. So ADC is all about making changes. The directors are all in their own individual right, extremely comfortable. So this is not a business organization solely for making money. No, that is not what we are. We are all about making a change in the life of our fellow brothers and sisters in the African continent. We are all about changing this world and making it a much better place we met it when we leave. So our aim is that tomorrow when we are no more here, posterity will remember us as those Africans that were able to come together and make some changes that had impacted positively the lives of our fellow Africans. They say charity begins at home, hence we are launching this marketplace, this platform that we've talked about here in Nigeria. Soon and very soon, we are going to be going across the continent and launching this same program over there as well. So at this point in time, I would like to say thank you for coming, and I would like to pass on to my